Hi, my name is Victoria Chi, and I will be presenting on the effects of a multisectoral food security intervention called Shamba Maisha on community empowerment in Kenya. First, I will provide a brief introduction to this research. Food security is a social determinant of health that is tightly linked with morbidity and mortality. Across the globe, the prevalence of food insecurity is particularly high among those living with HIV/AIDS. Together, a high burden of food insecurity and HIV weakens entire communities. There is an increased caregiver burden placed on others, as well as decreased overall economic capacity and decreased resilience to external shocks. Studies have also shown increased political instability in areas with high food insecurity and HIV. Caretakers who have HIV and are food insecure are also less able to care for their children or plan for their children's futures. In these ways, food insecurity and HIV infection are not just problems affecting individual people, but rather they are problems that affect all of society. In this study, we examined whether improving food security for individuals might create positive change on a community level and the mechanisms through which it does so. I'll go over the methods we used to explore this research question. Shamba Maisha was an intervention established to study how promoting food security among individuals living with HIV in Western Kenya could improve their health. The population that we reached were adults living with HIV who had either moderate or severe food insecurity or malnutrition. They needed to have access to farming land and surface water. The intervention entailed providing microfinance loans, trainings in how to farm and how to manage finances, and a water pump to HIV-positive individuals. Through this intervention, participants could become farmers and achieve sustainable food security. This qualitative study was embedded within the larger Shamba Maisha initiative. This study was conducted at the end of a 2-year cluster randomized controlled phase 3 trial of Shamba Maisha, which included over 700 participants from 16 health facilities in Kenya. 40 in-depth interviews were conducted with participants in the intervention arm. The interviews were then transcribed and translated into English. First, a thematic coding framework was developed and double-coded, after which an inductive approach was used in which interviews were examined for emerging themes and fine codes were developed. We then aggregated, compared, and analyzed representative quotes and divergent opinions. I will now share the main results that we found through these interviews. The data gathered in this study yielded this model for how achievement of food security for individuals can affect their surrounding communities. Shamba Maisha participants described how, after achieving food security and gaining a source of income, they were able to teach farming practices to others, become leaders within their communities, and give freely to those who needed it. Participants also sponsored the education of children, improved community food security, employed other local people, and promoted women's economic empowerment. Here are some representative quotes from participants themselves. Many participants began to teach their friends, family, and neighbors how to farm. Some participants described either becoming elected officials within their villages or becoming respected farmers who would be consulted by the village chief and village elders. Many also described giving back to those who were more vulnerable. Here, a participant says, "Before joining Shamba Maisha, I would go to friends and neighbors to ask for food. Nowadays, we can give freely, once in a while, to those who do not have." Participants who achieved food security improved their societies in other ways as well. When participants were able to save money because they did not need to spend it all on food, their first priority above all else was to pay for the school fees for their children who used to always be sent home from school because they could not afford tuition. As one participant said, "After joining Shamba Maisha, I feel that the financial burden has been uplifted. I have food for my family and school fees for my children." Some participants even began paying school fees for children of relatives. In addition, many participants described how people started coming to their farms to buy produce, and they became the food suppliers to local schools. In this way, Shamba Maisha improved food security not only for individual participants, but also possibly for the surrounding communities. Finally, some participants described now being able to employ other local people on their farms. These participants were proud of being able to help others through giving them paid work. Additionally, some female participants described using income from their farms to join women's table banking initiatives and other women's empowerment groups. Some male participants also described giving income from their new farms to their wives in order to let their wives start their own businesses. Shamba Maisha therefore may have helped to economically lift up many women in society beyond just the participants themselves. There were, however, some gender differences in the ways men and women contributed to their communities. In particular, only men described becoming elected leaders or consultants to the village elders. Additionally, men tended to be the ones who talked about how proud they were that they could now employ others on their farms. Now, I'll give some final thoughts and conclusions. Shamba Maisha began as an initiative to assess the effects of improving food security for individuals by helping them become farmers who could grow their own food. However, we now know that the effects of food security spread beyond the individual. That is, helping even a single person achieve food security can create a ripple effect that affects the entire community around that person. Food security is an upstream factor that can strengthen entire communities that have been deeply affected by both HIV and lack of access to food. Of course, there are limitations to the study and gender inequities continue to exist. As such, there are countless opportunities to build upon this research in future studies, as well as to implement initiatives that lift up communities through helping people achieve sustainable food security. Finally, I want to give my utmost gratitude to every member of the Shamba Maisha team, to our generous funders, and most of all, to the Shamba Maisha participants who shared their stories with us. And thank you so much for listening.